Hello, and welcome to this afternoon's presentation. Franciscan Health and Community Health Improvement Partners presents Building Resiliency in Youth, Challenges, Interventions, and Resources. Thank you for making your health a priority by spending an hour with us. I'm your host, Robin Ali, Marketing Specialist for Franciscan Health. I'm excited for our team to share some great information with you about building resiliency in youth. This afternoon, with the help of one of our experts, we will help you better understand these following points. The need for social emotional learning within our communities to build resiliency, explore bystander intervention tactics as evidence-based tools that provide protective factors against adverse environments, review strategies based on a social ecological model at the individual, relationship, and community level, outline skills for ages 6 years to 17 years of age will be reviewed and shared as action steps for immediate adoption into practice. Before we get started, I'd like to share a few housekeeping items. For this virtual event, participants are muted. We ask that you remain muted to help us avoid background noise and interruptions. However, if you have any questions to ask the presenter during this presentation, please type them into the Q&A or the chat window. We'll be answering your questions at the end of the webinar. Our administrator is taking care of everything on the back end, so if you're experiencing any technical issues, just type them into the chat window and we'll work to resolve them as quickly as possible. If you miss anything, no need to worry. We'll send out the recording of today's presentation to you in a follow-up email. A little bit of background about our presenter, Ms. Stacy Quick. Ms. Stacy Quick serves as Community Health Improvement Coordinator for Franciscan Alliance, implementing community-based strategies to overcome social and economic barriers to build a culture supporting trauma-informed practices. Current work lies in advocating for cross-sector collaboration to build support systems that lead to increased capacity for resilience, with the focus on identifying shared value systems, implementing evidence-based practices, and collaboration of resources. Stacy has many years of experience working in community-based solutions to violence prevention with a focus in youth interventions. Experience includes working with Indiana Coalition Against Domestic Violence, Illinois Coalition Against Sexual Violence and Assault, working as a prevention educator, affiliate, Indiana Coalition Against Domestic Violence, and being a co-founder and executive chair of Power of Prevention Coalition. Also serving as a YWCA Greater Lafayette Domestic Violence Intervention and Prevention Program. Expressions Healing Art Support as a Window Between Worlds Certified Trauma Support Facilitator. Stacy holds a Master's in Healthcare Administration from Colorado State University with a specialization in leading the learning strategy. Now, without further ado, please welcome our presenter, Stacy Quick.
Thank you, Robin, and thank you for all of the attendees for coming. We're going to be diving into a lot of information today on youth resiliency and what that looks like in today's society and in this modern post-pandemic world. I will be sharing these slides with you as a follow-up email that will be sent out. So don't worry if you want to take screenshots, they're going to be shared with you, along with all of the resources towards the end are going to be clickable links. I have here my contact information that you can have that if in the future you have youth interventions or anything that's questions that you need to have. Here is my contact information by email. I'd like to start with an icebreaker in the chat box. Let's tell us a little bit about yourself. And what I'd like to know is, what is your why for wanting to help youth become more resilient? What is your why for wanting more information? Go ahead and take a moment and put that in the chat box for us. And you can also share a little bit more about yourself, just so we kind of know who's here and the background we have of who I'm sharing this information with today. So what is your why for wanting to learn more about resilient youth? My why comes from learning more about ACEs and adverse childhood experiences and how to really increase our capacity to look at trauma and how it affects the child. And I also have children of my own. So just in educating myself and learning more about how do we do this together, because it really does take a community. So we'll give you just a few more moments to share in the chat box a little bit about your why. I'm going to say the youth that we are serving are eventually going to be the ones that are doing the work that we're doing. And if it was a perfect world, we wouldn't have this work to do anymore. Okay, so let's go ahead and start diving into the information. For some reason, I can't move the slide. There we go. So what we're going to learn and talk about today, we're going to talk about challenges. What are they? What are the current challenges facing our youth? We're going to talk about interventions, different social emotional learning tactics. What does it actually mean to have those skills? Bystander intervention. What is that? Is it a program? Is it something that we can access and utilize in our day-to-day? And then also, what resources do we have access to? What do we have here in Indiana? What national resources do we have access to that we can utilize and learn more about how do we really build resilient youth in today's society? So with that, let's go ahead and dive into challenges. I have another question. Before we dive into this, I want to get us all on the same page about what resilience is. So we talk about, we're going to be learning on how to build resiliency, but let's all first come down and define what is resiliency. So I'd like to take a second and let's ponder this together. And I'd like you to type your answer in the chat box. What is your definition of resilience? And you can keep it simple. Camera here. Okay, we've got ability to cope with challenges. Absolutely. So we're talking about, what does resilience mean? What is the definition? A good analogy for this is to think of different things that you can boil. Is when they come out, do they come out hard? Do they come out soft? Or do they maintain their consistency after they're boiled? To bounce back, to rise above challenges, mental stamina. And it sounds like, as a whole, resiliency is the ability to face adversity or face troubles or issues and be able to come out on the other side still functioning and able to cope and have healthy coping skills. So these are all really, really good definitions. I like bending without breaking. Absolutely. Flexible has had a whole new meaning recently with COVID and how we're learning to navigate everything. It's almost where flexibility is the highest skill we can have right now. But how do we do that for you? We're going to talk a little bit about that today. So if we actually defined resiliency, I'm going to read this to you because this is from the American Psychological Association, or APA, better known as. Resilience refers to both the process and the outcome of successfully adapting to difficult or challenging life experiences. It's having mental, emotional, behavioral flexibility and the ability to adjust to both internal and external demands. So when we dive into our simplified definition is bending without breaking, or having to face adversity and be able to process the information. I like this definition because it doesn't just talk about the outcome. It says it's the process. So resiliency is twofold. We have the process of successfully adapting during the difficult situation. And then after the difficult situation has occurred, what does that coping skill look like? How is that person or that child processing a traumatic event? And it's also comprehensive. It's not just one area of a person's life. It's the mental ability to come back or to bend without breaking. It's emotional, it's behavioral. And a lot of times what happens when we think about resiliency is we don't see the impact until the behavior starts to come out post a traumatic event. So as we move through this learning today, let's think about resiliency as a whole process, that it's two parts. It's adapting to the occurrence as it's happening and overcoming those challenges when they're in the midst of a difficult situation or a traumatic event. And then what happens after? So there's two parts to being resilient. I like to also come back to us together on what is a traumatic event and defining that together. So we kind of have a foundation of what resiliency is. But as we were talking about that, we mentioned traumatic events or adverse things that can happen. A traumatic event is an incident that causes physical, emotional, spiritual, or psychological harm. And it can be all of those. When we looked at the definition of resiliency, we saw that it wasn't just singular. It was mental, emotional, physical. The same thing happens as a traumatic event. How do we define trauma? It's comprehensive. It affects a person's entire whole being. A person experiencing the distressing event may feel physically threatened or extremely frightened as a result. And when we think about youth and the different age groups that we have, what does that look like? That could be different for each age group on what they define as being threatening or frightening. That comes into play with a diverse background. Different things culturally mean different things. And when we think about a distressing or event that could make them feel threatened, we have to also look at it from a perspective of a culturally diverse lens. So we're not thinking, how would I feel, or I see this event as traumatic. We have to look at kind of removing ourselves and looking objectively at the child or at the person and saying, this is how they live their life. This is the culture they're exposed to. This is their norms. These are their social activities that, they were raised on or that they're surrounded by in their environment. What could be physically threatening or frightening to that person? And that's going to be how we define what's traumatic for them. In some cases, we may not know how to respond, or individuals could be in denial about the effect the event has had. What traumatic events come down to is the person's going to need support and time to recover from the traumatic event, to regain that emotional and mental stability or have that resilience for that. So I wanted to get us on a baseline of, this is commonly what we are thinking about with resiliency. It's twofold. It's what happens during the traumatic event, and then also the outcomes after, and then what do we define as a traumatic event? And really, when we're thinking about traumatic events, having perspective versus experience. And again, this really designates and talks about a situation or occurrence as traumatic. It's going to be based on a person's or child's perspective of the situation and their experience. And that changes over time. So as we're talking through the rest of this scenarios and all of these different information that we're going to talk about, putting ourselves in the perspective of the child experiencing it, and then also looking, what is their history? What are they exposed to? What are their environmental impacts? And that's really how we start to dig down and understand what's traumatic for a child and how do we build resiliency based on different perspectives. And what does that look like? So in my mind, as I think about it, there are so many different perspectives and so many different experiences, and there's so many cultures that exist. How can we narrow down a singular approach or an approach that's going to work on building resiliency on all of these different experiences and perspectives, and especially of children of different age? We've got, rural, we've got urban, we have all of these different impacts and environmental situations that are going to affect that perspective. And we're going to talk about how we can do that. So I want to take a pause and do another poll and just ask, currently, what do you think are, if you could list the top 3 current challenges that are facing youth today, what would they be? Is it bullying? Is it technology impacts? Is it connectiveness? Is it mental health? What is it? If you could pick, even just pick one, what would that look like? We've got peer relationships, stress, anxiety. Absolutely. Mental health. I'd almost want to say mental health could encompass so many different ones. We've got peer relationships, stress. So take a moment and share with us, what are the current challenges facing the youth today? Social media related issues, absolutely. It sounds like we have some commonality here on social media, bullying, and the mental health. And I completely agree that those could be the top 3. A lot of communities are trying to implement youth summits and just asking different age groups, how are you coping? What is it that you need assistance with? How are you feeling? What are the issues and challenges that you're facing? And again, we're coming from our own perspective and our own experiences on what those challenges are. So as we're moving through this, also remember that the most important person who knows about resiliency and knows what challenges they're facing are the individuals and youth themselves. So we have an idea on what we think is kind of going on, and most likely we are absolutely right on. But it's also considering how we define resiliency and how we define traumatic events as being perspective. And what is the perspective of the youth or the person that we're trying to build that resiliency within? What does it look like specifically for them? We may have to just ask them, what challenges are you facing? Thank you for sharing all of your answers with me. So doing the work together, what does that look like? Doing the work together means we're going to look at community-based approaches. And how do we do that? We have to stay connected in order to be a community. We have to know what a community is for a youth, for an individual. And I like that a lot of your answers for what are the current issues facing youth today. We talked a lot about peers, peer pressure, peer relationships, social media related issues. When we think about community-based approaches, it's what is the community that is that youth, that person or that child? What does community look like to them? And it's the connections that are all around them, good or bad, positive or negative. It's all of the connections that they have. And for us, it's how do we build out those connections so that they're positive, so that they're having it, so that it's an approach that involves teachers, social workers, providers, the school bus drivers, the person, anyone who's interacting with that youth. That's how we kind of get from the social ecological model that the CD says this is the brand standard on how we develop resiliency and how we measure it. Is we have the individual approach, which is interventions that are just on the individual directly. Then we have the relationship is the next level. And then we have community. So it's looking at if we could put the person that we want to build resiliency in, or a group, a target group or age group in a specific community in a bubble, and think about as that person or as that child interacts through their community, who impacts them? Even if it's minute, even if we think it's small, what does community look like for that individual versus how we see community? So the social ecological model says this, that in order for us to build safe and caring communities that support the strategies that we're going to talk about for social emotional learning, there's all of these different frameworks that have to exist. And it's economic supports, promoting family environments for healthy development, providing quality education early in life, strengthening young people's skills. And that's what we're going to focus on today is social emotional learning and how do we develop their skills and how does that relate to building resiliency. Connecting youth to caring adults and activities. Again, that community that's around that child, what does that look like? Who is interacting with them? What activities and what individuals make up that community or those connections to that child? How do we make those connections positive by creating positive and fostering positive environments? And intervening to lessen harms and prevent future risks. And those can come at relationship, community, and society levels based on this model. So as a side note, there'll be a link in one of the resources that we'll share at the end of the presentation that talks about the CDC Connecting the Dots. It is an amazing tool that really looks at, when I talk about the social ecological model, it breaks it down into this big graph. And you can look at what are the risk factors, what are the protective factors at the individual level, at the relationship level, at the community level, and at the society level for a variety of different traumatic events for anyone. And it covers bullying, it covers suicide, it covers intimate partner violence, it covers community violence. There's all these different things, and it shows cross-section on how all of those interact together and what is the protective factors that can address all of those risk factors to lessen that harm and prevent future risk. There's also the 40 developmental assets. And when we think about that community structure for that youth or for that individual that we're wanting to build resiliency in, we have to think about what assets already exist and not just external assets. And a lot of us, as we're in this, when we think about assets, we think about organization, we think about buildings, we think about structure. But really, when we're talking about an individual or a person, there's different internal and there's different external assets. And this graph just shows us a little bit about external being the different support systems they have or connections or community. How do they get empowerment? What are the boundaries and expectations that that community or those connections or those cultural impacts have on that individual? Constructive use of time management. And then internal assets is their commitment to learning at any age level, positive values, social competencies, and positive identity. And if you go, there's a whole bunch of information about the 40 developmental assets and what those look like and what are those specifically. So for boundaries and expectations, it could be family boundaries, it could be neighborhood boundaries, adult role models, constructive use of time, could be having creative activities and having access to that. And these are all assets that help a youth or a child develop into being resilient. So now we're going to get into intervention. So we talked a little bit about challenges. What is this mountain that we're trying to look at and trying to tackle so that we can really serve and be there when we talk about mental health and anxiety and stress and depression for youth in today's society? So we're going to talk about social emotional learning, bystander intervention, and we covered a little bit about the 40 developmental assets. But when it comes to social emotional learning, we're going to go step by step on what that means, and it's going to apply to any age group. And then I'll tell you, and we'll talk about how it connects to building resiliency. So social emotional learning. These are all the different components for social emotional learning. we've got self-awareness, recognizing the emotions of self and the values as a strength and challenge, responsible decision-making, making ethical, constructive choices about personal and social behavior, relationship skills, forming those positive relationships or positive connections. Remember, we're talking about community and what that looks like for an individual or for a child. Making sure that there are those positive interactions, because again, connections and community can be both good and bad. There's, just like there are positive and negative coping skills, community connections in the environment that we're in can be both good or bad, or positive or negative. Social awareness, this is the biggest one, is the ability to understand and have empathy for others. The CDC has so much research and so much evidence that says one of the biggest protective factors for building resiliency, for reducing violence, for anti-bullying is empathy. And that comes down to social emotional learning. And that's what we're going to define and get into deeper here in just a minute. And then self-management, managing emotions and behaviors to achieve one's goals. And honestly, when we think about social emotional learning, this isn't just for youth. This isn't just for a child. These are the exact same skill sets that adults also need in order to have healthy behaviors, healthy coping skills, healthy connections, and healthy communities. It's all connected. So when we think about building the resiliency for youth, when that doesn't occur, when we don't have a strong foundation of social emotional learning, we see that the outcomes later on in life, there's risky behavior, there's more traumatic events, there's substance abuse, there's all of these different traumatic things, because those positive coping skills and learning how to identify how they feel and have a healthy way of expressing it hasn't been learned. So how do we build resiliency? We start with social emotional learning. When we have this type of learning, how do we make it effective? When we talk about knowing your emotions, how to set boundaries, how to communicate boundaries, those key components that we know are social emotional skills, how do we make those effective in the actual day-to-day education that we're offering? There's different components of SEL learning. Something that's assessed annually, ideally 4 to 8 sessions minimum. Evidence-based or best practice, and having an evaluation of learning. Now, when we're looking at all of these different components, typically what can happen is a lot of the time funds or programs are aimed at putting out fires. For example, we want to focus on reducing bullying in a school system or for a youth group. When ideally, instead of focusing on decreasing bullying, if we focus more energy and more resources on social emotional learning, that's going to create the value system of empathy within those peer connections, which is going to reduce bullying. And typically what happens is funding for prevention efforts is not a lot. There are more fires to put out than we have support for. Just like we think about mental health, when we think about the average mental health worker available for the average number of youth that need services, it's astronomically different. The same thing happens for prevention. So ideally, we want to have 4 to 8 sessions so that we are continuously giving these social emotional skills out to these youth, to these individuals. And honestly, it doesn't have to happen just at school. It could be a youth program. It could be a teacher. It could be any adult that has a positive impact on that child to really build out some social emotional skills. Evidence-based. So success is proven with programs and strategies that have these components. It's comprehensive. It talks about the different types of emotions that a person can have, how to set boundaries, doses and timing, how much are they being exposed to this information. It's theory-driven, having adequate staff and individuals like us who are doing the work know what it is they need to know and how do we simplify that for them. Being culturally relevant. We think about community and those connections and how that perspective and experience impact how a child perceives trauma, how they perceive that endangering or frightening event. Making sure that we're thinking about the social and economic and cultural things that are happening so we can identify more where do we need to help them build resiliency at. And then also having varied teaching methods. Just like every other lesson plan or every other topic that we try to teach a child, there's different types of learning systems. There's written, there's verbal, there's kinesthetic, there's all of these different types of teaching methods, and we need to be able to expose youth to all of the different ones. So we talk about what are the exact components of social emotional learning. One of the biggest factors that we can look at is relationships. It's the different connections we have in our lives and defining two things. What is trust? Who can I trust? When we think about what is trust, it can be hard to just come up with a definition of define what the word trust means. And then a lot of our prevention efforts and a lot of the conversations we have around youth and mental health is reaching out to a trusted adult. When we think about a trusted adult, we have to dive a little bit deeper and think about who can I trust and why do I trust them? Especially in the younger ages between 3 to 8 years old, when we're asking them, who do you trust? A child is automatically going to say things like a family member. I always trust them because they're my family. But if we dive a little bit deeper and think, why do we trust a person? We start to look at how they feel. Do you feel comfortable around this person all the time? Do they respect your boundaries? If you say something makes you uncomfortable, do they stop that activity? So not just thinking about who can I trust and what is trust, why do I trust a person? Do they deserve to have my trust? And that's really one of the singular things that makes a difference when we talk about prevention efforts and building resiliency, is identifying how do I feel? Did I communicate it? Did that person respect it? That's how I know I can trust that person. So as we're talking about, go to that trusted adult or go to that trusted friend who can help you connect you to another resource, especially for mental health for youth. We have them go to these external individuals or organizations, but how do we know that what that trust is and defining that for that individual? And then boundaries is huge on what is the process. So when we say social emotional learning is about knowing my emotions so I can set my boundaries. But that's not just about setting my boundary. It's establishing it, teaching, and really diving into what are feelings, what are emotions? How do I know what emotion I'm feeling? That's establishing what I feel. What I feel is going to set my boundaries. And that boundary, I need to be able to communicate how I feel. One of the tests that I typically do when I first was doing prevention work, I'd walk into a classroom. And it didn't matter what age group, it didn't matter if it was a rural school or an urban school. If I came in there and I said, greeted myself and gave an introduction, and I said, I want everyone to say out loud, that made me uncomfortable. It's like deer in headlights silence. And that's where we come into, we teach them to know what their feelings are, but can they communicate it even when it's difficult, even when it's hard? And it made them uncomfortable. Can they out loud communicate that made me uncomfortable? I don't like how that felt, because then that traces back to, if I know how I feel and I can set a boundary, if I can honor it around this individual or around this group of people, I know I can trust them. And that trust is what builds the foundation for being able to reach out for support when that individual, when that child is in that traumatic event and they need that extra support system or that extra person or that adult to step in and intervene. We have to be able to teach them what is trust. And that all comes back to, do I know how I feel? I've established how I feel. Can I communicate it? Can I speak up when I need to? And can I honor it even though situations might change? And that in turn, we can think about emotions. being able to identify how we feel. And there's different perspectives. Again, there's the subjective experience on identifying emotions. There's also physiological responses in our body. So we're talking about teaching these age groups social emotional learning. We're talking about emotions. It's not just a feeling. There's a psychological or physiological response that happens. And what does that process look like? Because that in turn becomes a behavioral response. Now, whether that's positive or negative depends on the skill set of that youth or of that individual. And then we come to communication. So if we could look at this as a process from the start to finish, it's, do I know my emotions and how I feel? Do I have that competency? Do I have all of the words? Do I understand what it is to have emotion and having emotional intelligence? That's step one. Then we have the ability, if we know how we feel, I can set a boundary, because then I'm going to know if I'm comfortable or uncomfortable, if it feels good or if it feels bad. From there, can I communicate how I feel? Do I know what I feel? Can I identify it? Can I communicate it? And above all, the biggest thing we can do is, once they communicate it, is it assertive? Can they honor that? Do they have the language vocabulary? Do they know the physical response? Can they access nonverbal cues to really build up that rapport? But above all, is that communication assertive? Can they honor it? Can they honor those skills and how they feel and setting those boundaries, even if it's difficult? And that's where the practice comes in. I shared a little bit ago about how I would come to a classroom, and that's how I would define how assertive is the group of individuals that I want to teach them resiliency to, is having them practice that made me uncomfortable. And I would do that again after I would go through the session. We would talk about emotions and we would practice communicating how we feel. It was a huge difference, even for adults. Even if you were in a group of peers and something made you uncomfortable, like how difficult is it for us to speak up and say how we feel? But yet that's something that we expect and need the youth to be able to do. So how do we build that with them? How do we give them strength to overcome that and be able to say, this is how I feel. I'm going to honor this, even if everyone else doesn't agree, if someone else doesn't think it's right, is by having them practice. And that comes into bystander intervention, because if a child or an individual can know how they feel, they can honor their own feelings, set boundaries, be assertive about it, they're going to have that strong resiliency, right? They're going to be able to set boundaries and have the ability to have empathy. And all of that empathy comes from, let me backtrack. There's a difference between sympathy and empathy. Sympathy means I understand what it's like to feel sad. Empathy means I understand exactly what that feeling feels like. And when we lean into empathy, bystander intervention becomes a natural response. And bystander intervention is, how do we help others in a way that's still safe for ourselves? It's how do we stand up and connect a person or a peer to an adult if they need assistance? How do we do that in a way that's safe for us? If we understand what our boundaries are and how we feel, we're going to understand what's safe. And when we think about what is a trusted adult that I can, hand my friend off to if they are having, a mental health crisis or they're needing assistance, if they understand what trust is, we're going to be able to safely say, yes, you are able to hand that out to a trusted adult, because we've strongly defined what trust is and why a person deserves trust and why an adult deserves to have the trust. So that leads up to this question. We think about, okay, we've got an individual or a child that has social emotional skills. Okay, we've built that up. We've done all of this practice. We had the 4 to 8 sessions over a couple of years. We're really built up what this looks like. Can it still be difficult to help others? Absolutely. We see this all the time in our everyday lives. Being able to help another person, even when you're in a crowd of people that may disagree, can be hard. But if we have individuals and adults who are socially, emotionally competent, where they can know how they feel, they can set boundaries and be assertive in how they feel in those boundaries. When they go to help others, it's not going to matter what other people are thinking or other peers are thinking. And one of the biggest ways to explain this is bullying. When we see this in school, how we notice that a lot of your answers were, we see a lot of bullying right now. How do we stop this? How do we step up? It's teaching the youth how to connect to a trusted adult. How do we safely intervene? Is it by speaking up and telling another adult that can handle the situation? Is it knowing that they can help and understanding that it could be difficult, but if you know how we feel and we know if we can be assertive with what we believe is right, that's when we can overcome that barrier or that resistance to wanting to help someone who needs assistance. And we're going to know that they're going to have that motivation if they have developed empathy. And that comes directly from having emotional intelligence, which leads back to, do I know feelings and emotions? Do I know the physiological responses? Can I identify it? Can I communicate it? Can I set a boundary? So everything is connected back to social emotional learning. So with that, we'll get into some resources. And what are they? Indiana Youth Institute, which has a huge amount of resources, from data to programs to research. And the link that will be in the slides that we send out is a snapshot. They have a snapshot that's live, has updated information from their Youth Summit data. That's a county snapshot. So you can look at state information, or you can look specifically at your county to see outcomes that are happening. What is the data? What are things that are happening? What's going on with that? The resources for national levels is very comprehensive. The CDC connecting the dots, what I shared earlier, how you can see that map of risk factors and protective factors. That's what that first link is. There's some for gun violence, there's different programs, there's all kinds of resources that are going to be available for you to look at, from SANSPA to violence prevention. But honestly, what it comes down to is that social emotional intelligence and being able to know how I feel. Can I set a boundary? Can I honor it? And then if I honor it for myself, can I help honor it for others? So with that, how do we do this work together? When we think about as a community, as we're all interacting differently with the youth and children in our lives, if we think about a positive, influential adult we had in your life, I want to leave you with this. How did that adult make you feel? What did they do? What was the difference between that adult and other adults in your life? When we think about trust and why an adult would be trustworthy, and we're wanting youth to reach out when they need help, or if one of their friends or peers needs assistance, and we say, reach out to an adult you can trust. How can we become that adult that's trusted? And when they think about, why do I trust this adult? How are we making them feel? What are we doing differently to be that positive adult that's trustworthy to that individual, so that when they need help and they need assistance, they don't have that resiliency yet, where they're in the midst of that traumatic experience, whether we think it is or not, because again, it's based on perspective and based on experience and what that child's life is like. And we don't know all the different components and aspects of it. Are we that person that's trusted that they can reach out to and be understanding? And just think about, as you're growing up, what was that positive adult that would be in your life? How did they make you feel? And then how do you want to make them feel? And then that just portrays our own social emotional learning, because in order to do that, we have to be able to have empathy for the youth that we're serving and know what it's like to feel alone, to feel scared, and to feel like everything's out of control as we're in the midst of a traumatic event. Okay, and with that, I will hand it back to our host.
Great information, Stacy. Thank you so much.
Welcome.
And we hope you all learned some new and helpful information. Now it's time for question and answers. Just as a reminder, if you have any questions, then please enter it into the chat. Stacy can see it there and she can answer any questions you may have. Not all at once. It was very thorough what you presented, but I'm sure there is one or two questions.
I do know there was a recent article that was sent out about the 988 hotline, and that is accessible for, having assistance for mental health crisis.
Mm-hmm. Okay. Well, maybe we will wrap it up, but there's no problem because if, there are follow-up questions, then they can always send them through. All right. Well, thank you all for attending this afternoon's webinar, Building Resiliency in Youth, Challenges, Interventions, and Resources. We want to thank Stacy Quick for sharing so much helpful information. Thanks, Stacy. We understand that your time is valuable, so we thank you for prioritizing your health to spend some time with us this afternoon. Once again, we'll send you an email with a recording of this session. Feel free to watch it again and share it with others who might find it helpful. You'll also receive a brief survey about this webinar and its content. Your feedback is truly important to us and will help make future seminars even better. So please take a few moments. All right. Well, thank you, Stacy. Thank you, guests, for registering and attending. We appreciate you all. Thank you.